the central government in India has now banned the manufacture, sale and distribution of over 150 fixed dose combination drugs. Now the drugs include some of the most commonly used painkillers, multivitamins and also drugs used in the treatment of fatty liver with diabetes and irritable bowel syndrome. The drugs were examined by an expert panel appointed by the government which found that combinations likely pose risk to human beings. The findings of the expert committee termed the combinations irrational with no therapeutic justification. Now, fixed dose combination drugs are an amalgamation of more than one active ingredient. While such combinations may help patients with illnesses such as tuberculosis and diabetes, it is also likely that they actually end up taking an antibiotic combination for fever when the general painkiller is only required. So clearly, a lot of concerns about what's happening right there, and also we'll be discussing this in detail. Joining us on the broadcast is Dr. Sushila Kataria, who's a senior director internal medicine at the Medanta Hospital. Kataria ji, appreciate you joining us on the broadcast. A very concerning update this, because a lot of people now be wondering what exactly are these fixed dose combination drugs. If you can just tell us what these are and also the ones that have been banned, are these commonly used in India?
Thank you very much, Ashish, for having me on your show today. I think this is a question many medical bodies which have been raising for a long time. So we need to understand fixed drug combination means two or more medicines are into one. So combinations can be divided as good, bad, and ugly. So good combinations, first we need to understand why fixed dose combination and what are the benefits. So the benefits could be it can reduce the pill burden of the patient. And sometimes two drugs which act synergistically, like they enhance the effect of each other, then it becomes a good combination. Like you must have heard the name of a cotrimoxazole, like the Septran tablet, which is a fixed drug combination. The two chemicals, they complement each other. Similarly, in tuberculosis, because compliance is a lot big factor. So if you're giving four medicines differently, the patient may skip one or two, which leads to resistance. So this is an example of a good combination. A bad combination could be where the two drugs are either not complementing each other. For example, one drug gets out of your system in 12 hours and you combine it with a medication which gets out of your system in 24 hours. So they are not pharmacokinetically and pharmacodynamically compatible. Because one drug you need less often, another drug you need more often. So if you combine these irrational combinations, then you end up either over-treating or under-treating and increasing the side effects of the medication. And sometimes you put antagonizing medicines. One you put a cough suppressant and another one you put a liquefying agent into a cough syrup, which the body doesn't really understand whether the cough is to be taken out or it is to be suppressed.
Absolutely.
So that becomes an
Kataria ji,
antagonizing
you're talking about pharmacokinetic compatibility. You're also talking about how these combinations are irrational. In fact, this expert panel, what they've said is that they've also said a similar thing. They've called it irrational amalgamation, irrational combinations. Do you also think, because I was just reading up about this in the past as well, about what's happening, and apparently this is a very serious concern that a lot of medical professionals across India have been raising. They have been also alleging that this is a very easy way for for people to actually sell two drugs when only one is required.
Exactly. And sometimes, one drug comes under the price control. So what some of the pharmacological companies, they would put an absolute useless combination into it just to get out of the price control band.
Okay. And isn't there any checks and balances? Because now what you're telling me is very concerning. The fact that there are useless combinations of drugs that are being given to patients right now. And what usually happens is that when a doctor has written a prescription, you actually just go and buy it, or you buy it over the counter. And people actually don't realize that this combination of drugs that they're taking, is this actually useful? And probably what happens is that while the benefits may also multiply, the adverse effect, the side effects also multiply, and that ends up actually harming the patient even more.
Exactly. So whenever a fixed drug combination is approved, I think the authorities have to make sure that it falls into a rational combination. We are not against all fixed drug combinations, but whenever a drug with lot of ingredients is approved, it has to be scrutinized very well, that each and every component is actually helping each other. Otherwise, one tablet, people put 26 chemicals into one, some multivitamins, antioxidants. These drugs are actually, they don't help, and patient has to, if they buy, then it becomes costly on the pocket of the patient. So yes, drugs should be used very judiciously. especially in our country where antibiotic resistance is emerging as a huge problem, and we do not know in coming decades what would happen, because the discovery of antibiotic is much slower than the antibiotic resistance. So we should, by and large, should be using less medication very rationally whenever used, and approval of fixed drug combination should be restricted.
Absolutely. Also, Kataria ji, this is again, like you said, it has a ripple effect. Like you pointed out, the fact that antibiotic resistance in our country, that's a major concern. And the fact that we are now taking drugs with irrational combinations, we don't even know what the outcome is going to be in the next few decades. Because what happens is, at the end of the day, these bacteria, these viruses, everything, they also get resistant to drugs. And again, what happens is, end up spending more on medicines, we end up spending more on these useless combinations, and again, at the end of the day, it's the consumers that actually suffer.
That's true. That's true. So that's why every prescription should be written by a trained medical professional. We should get rid of the quackery which is involved in our system, and there should be training of all the medical doctors, especially the students which are about microbial stewardship, and every time there should be refresher courses on that. Whenever we prescribe any antibiotic, as a responsibility as a doctor, I would say to myself also and to my colleagues, we should always ask ourselves this question, whether this medication is required. Would lifestyle modification alone would help? How much should be duration? Medication should never be underdosed. It should never be overdosed. There should be an adequate therapy, because underdosing and overdosing both has its own repercussions.
Okay. Also, Sushila ji, now because a lot of viewers are watching right now, they might not really understand these technical terms, and they might actually be wondering if they also, without knowing, might be consuming these fixed dose combination drugs as well. Are there any common FCs that people actually end up buying on an everyday basis? Because what happens is, usually there are a combination of drugs that people think that, okay, if I take this, my fever is to go. If I take this, my cold and cough is cured. But actually, at the end of the day, it's actually not helping them. It's harming them in the longer term. So are there any popular combinations like that that are out there in the market today that people don't know and are still, it still ends up harming them?
So it's not right for me to use name the brands, but what are the commonly used medication is that most of the skin ointments, they will have an antifungal cream, they will have a steroid with it, which actually antagonizes the effects, with an antibiotic also, with an anti-inflammatory also. So topical combinations without one particular ingredient, mostly for skin itches and rashes, it is being used. Then mostly multivitamins and multiminerals are sometimes they contain, they'll say that it has a CoQ also, it has a B12, B3, it has this mineral, that mineral, I mean, this kind of combinations. Thirdly, sometimes, very commonly, we are taking two anti-inflammatory medications like Brufen and Boveron along with a muscle relaxant. So this is also very commonly used. Thirdly, patients can sometimes use underdosed combination of antibiotic like ofloxacin along with cefixime is a combination which doesn't have any rational, I think. So this is also very commonly used, and in our country, a lot of drugs are actually, every drug is available over the counter. So we should restrict the use of OTC drugs, which have started coming in sedatives, narcotics, and antipsychotic drugs. Similar act should come for the antibiotics as well.
Absolutely. And like they say, any shortcut is always, of course, it is filled with dangers, and these over-the-counter medicines, I think that again end up harming the consumers even more. So before we wrap this discussion, Kataria ji, you've been, of course, talking a lot about the fact that we need to only take medicines that have been prescribed by trained professionals. Any message that you have for the viewers right now watching who might be concerned? Because again, Center comes out with advisories, they come out with directions to ensure that such things do not take place. But at the end of the day, a lot happens as far as over-the-counter medicines are concerned. So any tips for the consumers who are watching right now as to what exactly they should do to avoid such irrational and also dangerous combinations of drugs?
So I would like to tell everybody that it is a very common mistake which all of us make, and general public as well, that people say I'm having viral and then taking antibiotic. The statement has an irony in itself. So never take an antibiotic for a viral illness. Have some patients when you have a cough and cold, take symptomatic treatment. Do not take antibiotic. Then, and even if you're taking anti-inflammatory for simple fever and all that, if your symptoms are not getting better in 3 days time, please do consult doctor. if you have to have antibiotic for a particular condition, because antibiotics are definitely helpful in the special medium blood or something whatever is required before taking antibiotics, so that your antibiotic can be pruned. Every diarrhea does not require antibiotic, so this is on antibiotics. And as far as the combination medications, do not think all medications are harmful. Chemicals can have good and bad effects on your body. Do take care of your good health yourself. Eat well, sleep on time, so that you require less medication, because you will fall less sick if you take a good care of yourself.
Absolutely. Kataraji, it's ironic the fact that actually I had a similar experience a couple of weeks back where there was someone who actually had a viral infection, a viral fever, and one of the suggestions that coming from the person at the at the medical store was that antibiotic drugs is something that he should take. In fact, this is now again an eye opener for a lot of people. I believe the fact that you're also calling it very ironic that these are kind of untrained professionals that are actually now suggesting combinations of drugs. And again, the viewers watching right now, the biggest solution to all of this is that you only consult a trained professional before taking a combination of drugs. That's the best way to actually steer away from the danger. Kataraji, appreciate you joining us on the podcast, enlightening us about this entire topic, helping our viewers understand the safe practices as far as fixed dose combination drugs are concerned.